Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So now tell me the investigations that you would want to get done before you start with HRT. Think about what do you want to, now your HRT is, remember, given for a longer period of time. You will not give it for 3 months or 6 months. Okay, you're planning maybe for 10 years. You're planning for at least 5 years. So a patient who's come to you, let's say 48 years of age, that, I'm feeling hot flushes, my periods are all haywire, and I'm probably going in for menopause, I'm not feeling okay with my sex life, decreased libido, dryness down there, itching all the time. Would you not like to help her out? And if you're helping her out, what do you say? If she says, how safe is it? How long can I take it? What do you say? For now, you take for 3 months and follow up with us. Again, 3 months, you'll follow up with us. Then 6 months, you'll follow up with us, and then annually. And in that case, how long can she take it? She can take it till the age of natural menopause, which is usually 55 years. And hopefully by that time, her symptoms must have abated. But there are people who carry on with menopausal symptoms for a very long time. So will you say, no, you can't have it now? So they say that you can take it for 10 long years whenever you start it, or until the age of natural menopause, right? So now tell me that what should be the investigations that you would want to see in a patient whom you're about to prescribe hormonal pills. Okay, now remember one thing, very discreet, guys. Okay, come on, answer this question. This is going to be fun. Tell me, can HRT be used as contraceptive? Can HRT be used as a contraception? Or suppose a patient comes to 48 years of age and she says, my periods, they are coming and they are not very regular, and but I'm having menopausal symptoms. And at the same time, I am on OC pills. Do I need to continue that? Or, okay, I'm making it too difficult. Let's say she's taking condoms on and off, but she doesn't want to use it anymore. So she says that you're putting me on HRT anyways. I hope it will work as a contraceptive also. So what will you use? What will be your answer? Do HRT work as a contraception as well, because it has a combination of estrogen, progesterone? If yes, why? If no, why? What? There's no answer? Is it? So the students in my class, Pooja, both the Poojas, and Sush, Pragati, come on, Sonalika, you can say yes, you can say no. It doesn't matter. I do not expect a consultant level answer from you people. I just want to know your thoughts. Can HRT be effective as a contraception? Okay. If it is no, can you please tell me why? Okay, others are not even trying, is it? All right. This is strange. Okay, what is the reason? If it can be used as a contraception, what is the reason? If it cannot be used as a contraception, what's the reason? Yes, I need to know from Sonalika, Soma, Nisha, Paramjeet. I need to know, what do you feel? What's your thought process? Okay. All right, guys. So first of all, let me be very clear about this. When you're giving HRT, you are giving it at a very low dose, just enough to maintain the bodily functions of estrogen loss. Progesterone is usually added because you do not want to give uninhibited estrogen in the body, otherwise progesterone has no functions. Usually all the bodily shape, the secondary sexual characteristics, the desire for sex, the skin, hair, and bones, cardiovascular, this is all actually maintained by estrogen hormone, not the progesterone. Progesterone is only added to safeguard the bad effects of estrogen on the body. So very low dose of estrogen and progesterone is given. And can you tell me the estrogen used in contraceptives, OCPs? Which estrogen are we using? Guys, this is very important. Okay, you've got to know this. What estrogen are we using in OCPs? Absolutely, thank you so much. Ethinyl estradiol, right? We do not use ethinyl estradiol in HRT preparations, nor are we now using this thing, equine estrogen, no more. Okay, conjugated equine estrogen we used to use before, CEE, we're not using it nowadays. Why are we not using it? Because it's very difficult to quantitate the estrogen in the body with these two. So rather than that, we're using a biological form of estrogen, and that even in very small quantities, it is effective in the body. Similarly, for progesterone, we are using either a micronized progesterone, which is again very, very safe for HRT, or we are using MPA or NETN, which are traditional the same progesterones, again at very low dose. But that's not the point. Point is not the progesterone. Point is the estrogen. The estrogen factor is being used in such a low quantity that now listen the answer, HRT is not a contraception. It will not provide you contraception because the low quantity of the hormones that you're using in HRT, which is just sufficient to maintain the bodily functions, and the ill effects of the loss of estrogen on the body. All right. So this was just besides the point. Now coming back. So what investigations would you like to get done before you're starting her on HRT? See, we just spoke about liver disease, at least LFT, you can say, right? If she's having any undiagnosed this thing bleed, maybe you can do a biopsy, a baseline ultrasound. See, so first of all, you'll always start whenever you are giving any medicine to anybody, you have to start with a history. Personal history, family history, complete examination, BMI, blood pressure, very important, history of smoking, alcoholism, because you've got to be cautious. You have to decide whether we have to give her rings, patches, transdermal, oral, which formulations, which dose. I'm going to describe you step by step, but here it is very essential that you know regarding the patient. So there is a performer when you're taking a history, isn't it? You ask about the current symptoms, what she's having, which one she feels are very, very distressing to her, and which ones are the ones she's okay with. For example, a patient comes to you and says, I'm having a lot of itching down there. I have to rush to the toilet again and again. I'm not leaking on the way, but I'm having difficulties with, having sex with my partner. Best HRT for her will be a local estrogen ointment. So you are not blindly giving her HRT tablets. You are seeing the symptom that per patient has, starting right from there, right? Okay. And not just that. For example, somebody says that I'm feeling very low in the mood. Sometimes I feel very, very irritable. My sleep disturbance, and then now you cannot give her local estrogen, is not going to give her any benefit. So now your mind is going that, oh my God, I have to give her some medicine, either oral, transdermal, something I have to give. But in that case, I need to know more about her. So if there is no risk factor, she doesn't smoke, she's not hypertensive, not diabetic, no history of any breast cancer, endometrial cancer in the family, no VTE, no. Most of the patients, are like that. But at the age of, let's say, 48 plus, when these people are coming to you, they are usually either hypertensive, diabetic, hyperlipidemic, or, in Western countries, they smoke and drink also. So you have to be a little cautious. So you have to take a complete history of the symptoms. Menstrual history, last period is very important, and do not presume that she is menopausal or heading towards menopause, she cannot be pregnant. Okay.